Breathing in, there is awareness of breathing in. Breathing out, there is awareness of breathing out. Breathing in, breathing out. In, out. Where do we suffer? The physical body and psychological mind. Obsessive-Compulsive Disorders, Part 1. Obsessive-Compulsive Disorder, or OCD. Whether driven by compulsion to perform certain routines and rituals with fervent and unyielding repetition, or obsession with certain uncontrollable thoughts, those who experience obsessive-compulsive disorder are perhaps attempting to shift focus away from what are perceived to be obsessive, harmful thoughts with compulsive behaviors until the thoughts themselves essentially go away, or, in particularly insufferable cases, new thoughts, often regarding the compulsive behaviors themselves, takes their place. The OCD of pain and pleasure. When frequent and unpleasant thoughts or even memories from unresolved pain and trauma arise, obsession, it has become human nature to seek out pleasurable distractions to compensate, which, in and of themselves, invariably become self-reinforcing and, thus, essentially turn into a compulsion, a perpetual need to mitigate yet never resolve the core issues themselves. Primary obsessional obsessive-compulsive disorder, or POOCD. When someone experiences strong and impactful obsessions, as intrusive and unwanted thoughts, without compulsive behaviors typically seen in an OCD experiencer, they can be diagnosed as having primary obsessional obsessive-compulsive disorder. In essence, they are unable to control obsessive thoughts that might be insufferable in and of themselves, yet they possess at least some control over the behaviors that otherwise express a perceived need to distract themselves from the thought bombardments. OCD differences. While obsessive-compulsive disorder, or OCD, seems like the same condition as obsessive-compulsive personality disorder, or OCPD, there are important distinctions, with the primary difference being that OCPD is relatively free of obsessive thoughts and compulsive behaviors, as with OCD, yet the experiencer is obsessed with and compulsively strives and struggles to achieve very clear wants and desires regarding their obsessions, while those with OCD use compulsive behaviors in attempts to control their unwanted or intrusive thoughts.